that he wishes to make a statement. Minister.
Thank you very much, Mr Deputy Speaker. In compliance with Section 52 of the Northern Ireland Act 1998, I wish to make the following statement on the 23rd North-South Ministerial Council meeting in the Health and Food Safety sectoral format, which was held by video conference on the 26th of March 2021. Junior Minister Declan Kearney, MLA and I represented the Northern Ireland Executive at the meeting, while Irish Government was represented by Stephen Donnelly, TD, the Minister for Health, and Roderick O'Gorman, TD, Minister for Children, Equality, Disability, Integration and Youth. I chaired the meeting. This statement has been agreed with Junior Minister Kearney, and I am making it on behalf of both of us. The Council reiterated their appreciation to all those who have played a part in the response to the COVID-19 pandemic, in particular the health and social care workers who have led from the front and in the frontline response. The Council received a briefing from the Chief Medical Officers on the current public health situation. We discussed the ongoing response to the COVID-19 pandemic and the continued close and productive cooperation that had taken place between health ministers, chief medical officers and health administrations in both jurisdictions in delivering an effective public health response. The Council welcomed the signing of the Memorandum of Understanding between both departments to address cooperation and mutual support in critical care delivery. We noted the ongoing cooperation with regard to contact tracing, including the established processes in place for the sharing of the necessary details between the Public Health Agency and the Health Service Executive. Ministers welcomed the ongoing collaboration between the two jurisdictions on the further development of the Proximity app and noted the ongoing discussions between the two administrations on a data sharing agreement in relation to passengers arriving into each jurisdiction. We noted that officials from both jurisdictions will continue to consider the relevant learnings from the various phases of the pandemic and exchange views to foster commonality in their approach where possible, and provide a progress update at a future North-South Ministerial Health meeting. Ministers discussed the implications of the UK withdrawal from the EU, and the Council noted the update provided on the matter. Ministers welcomed the progress made to date in implementing the Council's current work programme in the health sector, and noted the Departments of Health have identified additional areas which have potential for further development and collaboration between the health authorities in both jurisdictions. The Council also noted the proposed revisions to the work programme in the area of child protection, which covers a 3-year period to 2024, and the Council agreed the updated work programme and noted that work to ensure the work programme reflects the priorities of each administration will continue, and that a further draft revised work programme will be presented for consideration at a future North-South Ministerial Council Health Sectoral meeting. Ministers noted the continued progress of the development and implementation of strategies to prevent the harm related to alcohol and drug misuse in both jurisdictions. We also noted the successful enactment of the Public Health Alcohol Act 2018, which is designed to address the health impacts of harmful consumption of alcohol in Ireland by reducing consumption levels, by delaying the age at which young people begin to drink, and by regulating the sale and supply of alcohol products. The Council noted the Department of Health NI consultation, Making Life Better, Preventing Harm and Empowering Recovery, a strategic framework to tackle the harm from substance use. And Ministers noted the potential for further collaboration on issues connected with alcohol and drug use, and the developments in relation to obesity prevention policy in both jurisdictions. We also noted that following the UK withdrawal from the EU, tobacco and related products on sale in Northern Ireland must continue to comply with the requirements of the EU Tobacco Products Directive. Ministers noted the update on suicide prevention initiatives in both jurisdictions, including joint working on the self-harm registry and continued collaboration between the Public Health Agency and the National Office of Suicide Prevention, in working with the GAA, the RFU and Ulster Rugby on a health and wellbeing project. The Council noted the updates on the All-Ireland Congenital Heart Disease Network and the North-South Living Donor Exchange Kidney Transplant Service. The Council noted that over 700 cross-border patients have received treatment from the North West Cancer Centre since November 2016, demonstrating how health cooperation delivers real benefits to citizens. Ministers noted that a renewed Memorandum of Understanding on the Northern Ireland National Cancer Institute Cancer Consortium was agreed by both health ministers and the director of the US National Cancer Institute on the 16th of March 2021. We also noted the work of the US-Ireland Research and Development Partnership in relation to cancer research, including work combining international expertise from the Royal College of Surgeons in Ireland, Queen's University Belfast, the Memorial Sloan Kettering Cancer Centre and GE Global Research. The Council noted that the Health Research Board has recently amended its host institution policy to enable eligibility for Northern Ireland research performing institutions to apply to act as a host institute for HRB grants. Ministers welcomed the update on the ongoing work of the All-Ireland Institute of Hospice and Palliative Care, and the Council noted the importance of continuing to support the ongoing work of the ALA-LHPC to improve palliative care and quality of life for people with life-limiting conditions and their carers across the island of Ireland. The Council approved the revised Child Protection Work Programme and the priorities set out for the 3-year period until the 31st of December 2024. And Ministers noted the latest position provided on other matters, including the updating of the protocol between Northern Ireland and Ireland for the handling of interjurisdictional child cases, and that an updated protocol will be considered at a future meeting of the NSMC. The Council noted that a knowledge exchange forum of child protection practitioners working at an operational level from both jurisdictions has been established, with an initial focus on the sharing of learning from implementation of the signs of safety methodology being taken forward in both jurisdictions. Ministers also noted that additional opportunities to extend the remit of the group will be developed in consultation with the NSMC Child Protection Officials Group, and an update will be provided to a future meeting of the Council. Ray Dolan, the Chief Executive Officer of Safe Food, provided an overview of the work of Safe Food and updates on campaigns related to weight management, hand washing and Christmas food safety. The Council noted that Safe Food has developed and distributed various resources in educational settings, delivered events including webinars and podcast series, and promoted healthy eating guidelines. The Council noted that Safe Food has engaged with customers on social media and carried out research in relation to food allergens, sustainable food policy and fiscal and pricing policies related to food and non-alcoholic drinks. Ministers received an update on the work of Safe Food networks, including community food initiatives and knowledge networks, and on progress in the tripartite initiative between Safe Food, the Public Health Agency and the Food Standards Agency in Northern Ireland, in rolling out minimum nutritional standards for catering for staff and visitors in health and social care settings, while supporting nutritional standards for food in schools. Ministers approved the process for the recruitment of the Chief Executive of Safe Food, and finally we agreed that the next North-South Ministerial Health and Food Safety meeting will be held in late 2021.
I call the Chair of the Health Committee, Colin Gilnute, to ask the question.
Cormac Last Ceann Comhairle agus Cormac Minister for the statement today. Minister, the first MOU, Memorandum of Understanding for COVID-19 cooperation, was signed in April 2020. You have announced that the Chief Medical Officer will be reviewing this MOU. On the 16th of March, in advance of this NSMC meeting, I had asked you about the scope and scale of the review, and I'd appreciate maybe if you could set that out for us today. Cormac.
I thank that member for his question on that. It wasn't actually covered at this North-South Ministerial meeting. We did talk about the MOU on critical care delivery, where we could actually interact and exchange ICU patients if necessary. But the ongoing review of the Memorandum of Understanding on the greater work, in specific with COVID, is ongoing, and we have asked that the Institute of Environmental Health actually conducts that review, rather than doing it either in-house ourselves or asking the Republic of Ireland government to do it. So we actually asked an external body to review that for us.
I call Gordon Lyons.
Thank you, Mr Deputy Speaker. The Minister has said that there are ongoing discussions between the two administrations on a data sharing agreement in relation to passengers arriving into each jurisdiction. These, of course, are the passenger locator forms. Mr Deputy Speaker, these discussions have been ongoing now for more than a year. Can the Minister explain why he thinks that the Irish Government have continually refused to share that information, and what impact he thinks that has had on our efforts to contain the spread of COVID-19 in Northern Ireland?
I thank the member for his question and welcome him to his position as Vice Chair of the Health Committee, and look forward to working with him in the future in regards to that. In regards to the passenger locator form, positive steps have been taken in the past few weeks and I would be hopeful that in the next few weeks we will be able to actually have that sharing of data in place. There are tests going on at the minute. One of the concerns that we raised while the progress was made was actually the data breach that had occurred in the Republic of Ireland to a number of their online and electronic systems. So we are currently seeking the reassurance that the security is in place that would allow that data sharing to proceed, but progress has been greatly made. It has been a large frustration and a great frustration that over the past year that we haven't been able to obtain that data, and the member will know I've raised it on various occasions, and the concerns that I've had on international travellers being able to enter Northern Ireland and the rest of the United Kingdom via Dublin Airport has been something that has been raised at Ministerial, not just at Health Ministerial level, but also between First Ministers, Deputy First Ministers and Taoiseachs as well, in regards to the concern that lack of data has been brought. But I am standing today hopeful that once and for all we may resolve that issue within the next few weeks.
I call Cara Hunter.
Thank you, Mr Deputy Speaker, and I'd like to thank the Minister for his statement today, which I welcome, especially the continued collaboration between the Public Health Agency and the National Office for Suicide Prevention. One of the things mentioned in the statement was a project of health and wellbeing with the GAA and Ulster Rugby, and we know that these sports clubs play a huge role, a positive role in all of our lives, so this will be most welcome. Can I ask for further detail on what this important health and wellbeing project may look like? Thank you.
And I thank the member for that valuable point. For what we've actually seen over the past number of months is the interaction and the support being given by the different sporting codes in relation, especially in regards to COVID. The suicide deaths, as we all know, are preventable, but they're not inevitable. So that's why this piece of work actually sets out in the strategy. The strategy itself includes a number of programmes designed to prevent suicide, and that includes the Towards Zero Suicide Initiative, the multi-agency triage team collaboration between HSC, PSNI and NIAS, and the resilience building and suicide prevention training. The strategy itself aims to reduce the suicide rate in Northern Ireland by 10% by 2024, and as a member will know, Protect Life 2 also ensures suicide prevention services and supports are delivered appropriately in deprived areas where suicide and self-harm rates are highest. When we engage with and utilise the strength that the 3 sporting codes bring to getting the message out, it has also mainly helps us reach those hard-to-reach target audiences in regards to mental health and suicide prevention, which unfortunately we know well in Northern Ireland is mostly young men, and that's why the use and the utilisation of those sporting codes is important to us.
I call Alan Chambers.
Thank you, Mr Deputy Speaker, and could I place on record my personal welcome to Mr Stephen Dunn to the Chamber today, and I look forward to working with him. I thank the Minister for his statement. In reference to the paragraph on the implications of the EU exit, does the Minister have any sense that the Government in the Irish Republic realise how potentially destructive and detrimental the protocol is to the supply of medicines and medical devices into Northern Ireland? And on that point, how confident is he that there will be progress this week on this very concerning issue from the European Commission? Thank you.
I thank the member. I think it only became too real for the Irish Government when Article 16 was triggered in regards to COVID vaccines earlier this year, and the real impact that had when they saw the dangers it could have. Whether they're completely alive to the real effect it's actually having on our health service, I'm not sure, but it's something that I continue to raise with Her Majesty's Government and Minister Ed Agar, who is leading on that vital piece of work. In regards to announcements, I would hope that we do see some direction of travel within the next few days. I know the concentration seems to be at this minute in time on sausages and fresh fruits, while we rightly get that issue resolved. But as medicines and those suppliers need 6 months notification to cease a market, it will become very real very soon in regards to anyone who wants to cease the Northern Ireland market at the end of this year, where those declarations will have to be made within the next few days, if not weeks. So I would hope that we see a resolution that actually sees those continuation of supplies being delivered to Northern Ireland.
Thank you.
I call Paula Bradshaw.
Thank you, Deputy Speaker, and thank you, Minister, for your statement today. You referenced the discussion around the potential for further collaboration on issues connected with alcohol and drug use. And I'm just wondering whether the issue of minimum unit price of alcohol was raised, and if you could give us any update on how your department's taking that forward here in Northern Ireland. Thank you.
I thank the member for the question. It was raised, and in fact I had an individual meeting with Minister Frank Feehan, who leads in this piece of work outside and as a conjunct to this as well. As the member will know, we are too aware of the dangers of the consumption of alcohol. I've been following closely the Scottish Government's introduction of minimum unit pricing since 2018. It is part of our substance use strategy, and that includes my commitment to hold a full public consultation on the introduction of minimum unit pricing in Northern Ireland within the next year. And I noted with interest the Irish Government's recent decision to proceed with the implementation of minimum unit pricing of alcohol. So the conversations are ongoing. It was at a stage where we would have liked to introduce it in both jurisdictions at the same time. Unfortunately, that's not possible due to, once again, our time frames and mandates not being concurrent and running at the same time either. But the issue of the consultation will be in my substance use strategy later this year.
I call Jonathan Buckley.
Deputy Speaker, and following on from Mr Chambers' question, how concerned is the Minister, and indeed how bothered is his southern counterpart, regards the harmful and selfish implementation of the Northern Ireland Protocol and the impact that it will have on medicines and medical devices in Northern Ireland, given that 98% of those items come from the GB mainland? And is there a recognition that an extension of grace periods, as welcome as they are in the interim, certainly will not cut it as a long-term solution to this vital issue?
I thank the member, and as my response to Mr Chambers indicated, I am concerned because it's my responsibility and my desire to make sure that the people of Northern Ireland get the same access to drugs and medical devices that are accessible to the rest of the UK population. As to how concerned the Health Minister of the Republic of Ireland is in regards to this issue, I'm not in a place to comment, because he can and he will speak to himself in regards to that. And as the member indicates, a grace period, while welcome, there is already an extended grace period for medicines and medical devices, which sees us run to the end of this year. But as I said in response to Mr Chambers, those suppliers of medicines and medical devices must give a 6 months notice to quit before they can actually leave a market. So it will be actually coming into effect within the next few days or weeks. If suppliers do intend to quit the markets in Northern Ireland, we're still supplying the rest of Great Britain, which is a great concern to me and those within my department. And I am meeting later this week again with Minister Ed Agar in regards to what has actually come out of UK-EU negotiations in regards to medicines.
I call Declan McAleer.
The Minister made reference to North-South cooperation and the importance of this in terms of our response to the COVID-19. In relation to agreeing a common travel policy, do you believe it should be recognised that in terms of all arrivals to the island of Ireland, despite the fact that we've got 2 jurisdictions on the island, it is one epidemiological unit, and should that be recognised in terms of agreeing like a common travel policy for arrivals into the island?
And again, I thank the member for the point he's raised, and it's one that has been raised numerous times over the last 15 months. And I think it was actually the Deputy First Minister who raised at one point that there should be a common travel agreement for across all these islands within the common travel area, because no matter just should we look at this island as an epidemic as one unit, the common travel area allows anyone to travel east-west as well without the checks and balances there too. So it makes more sense that we actually look at both these islands as an epidemiological unit.
I call John O'Dowd.
Thank you, Láscan Collier. Minister, during your statement you had mentioned that the Health Research Board in the South has extended its policy to cover research institutions in the North, such as our universities, which is a very welcome move and will further enhance the standing of our universities. But does this move replace the funding lost as a result of Brexit, or allow our universities to access EU research grants which were lost as a result of Brexit?
I don't have that detail with me in regards to what that actually allows in regards to accessing funding from EU bodies. but as a welcome step that research and development will still continue, as was the step where we were able to sign the Memorandum of Understanding in regards to cancer research between ourselves, the Irish Republic and the Cancer Centre in the United States as well. That was a big step forward, and I think a welcome commitment that we still saw that cross-border working, but also international working in regards to best practice on research and development.
I call Justin McNulty.
Minister, I'm sure you'll join with me in welcoming back the member for North Antrim after his heart scare last week. Good to see him back in the hot seat. Minister, I welcome this statement. A lot of very important matters covered. Contact tracing, critical care delivery, proximity app, data sharing, harm related to alcohol and drug misuse, obesity prevention policy, cancer, suicide prevention, so many important matters which wouldn't be being discussed if we had those North-South Ministerial Councils not happening. So, Minister, in terms of the work of the GEA, the RFU and Ulster Rugby on the health and wellbeing, and specifically in relation to suicide prevention, can the Minister advise, did discussions take place in relation to the impact of mental health of the pandemic on people? And does he agree that the importance of the role that the GEA, the RFU and Ulster Rugby and other sporting organisations can play as they deal with those young people on a weekly, daily basis, reaching out to the young people and giving them assistance and identifying where there are issues, potentially working together and collaborating to address this mental health crisis that could be an outcome of this pandemic?
Can I remind the member this is an opportunity for a question?
Okay. Very, very quickly, Minister, I met representatives of FC Mindwell on Saturday by coincidence, Glenn Patterson and Kieran Feehan, two soccer players who were great in their day but are now promoting a local soccer club team that work only to help mental health issues. Do you see the importance of sport? You've been getting that here, Minister.
Can we have a question, please?
Sporting bodies, do you know how they can be embraced to help deal with the issues at play here?
I thank the member for his statement. In regards, also thank and welcome Philip McGuigan back into the chamber. Philip, you're looking well, and I'm sure, I see you have on the front page of the Irish News that thank the health services in regards to the support they were able to give you as well. In regards to the member's point, look, we've seen the vulnerable community sector and our sporting codes step up through the pandemic in regards to getting the mental health message out, but also supporting our communities over the past 15 months as well. The organisations the member talks about, if they look to, and I hope to be announcing it within the next week, is the Mental Health Support Fund. So there is access to a £10 million pot of funding for organisations that are actually supporting and working with mental health organisations and individuals across Northern Ireland and the community. So I'd encourage the member not just to sing the praises of those individuals and organisations, but also encourage them to look to that funding as well, so they can continue that work over the next 3 years.
I call Philip McGuigan.
Last can call you, and I thank the Minister and all the members who have wished me well since I've been back, and I have put it on record, but I think it's important to put on record just my thanks to the professionalism and the courtesy and good humour of all the staff that I encountered in my stay in hospital. Minister, in terms of your statement, you've indicated the ongoing and welcome work on this island in health prevention and promotion in areas such as alcohol, drugs, obesity and suicide prevention. You will be aware of the work being carried out currently in the north here by the Communities Minister in trying to bring gambling legislation into the modern era. But the current very serious and growing problem of gambling addiction on this island needs a public health focus over and above a legislative focus in terms of education, prevention and recovery strategies. So, Minister, can I ask if there was any discussion at this meeting on the health impact of gambling addiction, and if not, could you commit to raising it at the next meeting?
And again, I thank the member for his point. It wasn't covered at this meeting, but it has been covered in conversations that I have had with his party colleague as the Minister of Communities as well. So it is something that I'll ask to be put forward on the agenda for the next meeting. I have no problem in doing that and including in the issues that have already been covered in the North-South Ministerial Council meetings that I've attended.
I call Jim Allister.
Thank you. This statement begins with the declaration that in compliance with Section 52, the statement is made. But of course, Section 52C, subsection 2, is very explicit in its terms. suggesting to me it's not made in compliance. Because section 52C(2) says, as soon as reasonably practical after the meeting, the statement shall be made. This meeting took place in March. There have been 23 different sitting days of the Assembly, not including today, since then. Why has it taken 3 months to make a statement where there's a statutory obligation to make it as soon as practicable?
I thank the member for the point. I know he raised it in a previous North-South Ministerial Council statement that I had made, because I think we'd actually omitted that paragraph in that statement, so we'd made sure it was in this one. In regards to the 23 sitting days, I think the member will note that I have been in this chamber on quite a few of them, making statements on many issues, should that be in regards to elective care and mental health, and answering a number of debates. We've brought this statement forward as soon as practicable, reasonably as we could get it in here as well, that I'd actually time to get it onto the paper and have it given its proper consideration because of the content and the large scale and very important issues that were discussed at that North-South Ministerial Council meeting.
I call Jerry Carroll.
Thank you. Thanks, Minister, for the statement, and I want to wish Philip Wigan well. Hopefully he's on his bike again soon. Minister, can I ask whether the discussion or the decision around the appointing a representative from the formula industry to the Safe Food Advisory Committee, I know I've raised this with you in written questions, whether that was discussed at all at this meeting, and given that he and his department, your department, are committed to the promotion of breastfeeding, what message does that decision send out, and to confirm whether he had any input in that decision, and again whether it was discussed in any detail or any concerns raised about that at this meeting. Thank you.
And again, I thank the member. I know he's supplied a number of written questions in regards to this specific point. I'm aware of concerns surrounding an individual appointed to the Safe Foods Advisory Committee last year. The appointments to the Advisory Committee are not representative appointments. The Advisory Committee provides technical advice and guidance to assist Safe Food in setting strategy and delivering on its business plans. There will be no impact on my department's initiatives on breastfeeding. Safe Foods Advisory Committee draws its members from a wide range of experts from the field of food science, diet and health, industry, communications and regulations, and they act as a resource to Safe Food and do not represent their employers. As long as the establishment of the Advisory Committee complies with the relevant legislation, the two health departments do not get involved in selecting the members.
And that concludes questions to the Minister of Health on his statement. I would ask members to take their ease for a few moments.